I came in here today to get a nose, a deviated septum. It's one side always continues to be stopped up, then it switches to the other side.
Gotcha. So the right side is more clogged up than the left.
Right now, and then later on, as the day go on, it'll switch over to where the left side is clogged up and the right side is free. And I'm experiencing like bad sinus problems.
Gotcha. Which side of the sinus do you notice most difficulty with?
The right side.
Right side. Got it. Okay. Also, during the consultation, you shared with us that you had a deviated septum surgery as well.
Yes, I did.
Okay.
Deviated septum surgery, and it worked for 4 days. I had both nostrils cleared, and after that, it went right back to the same problem.
Got it. And when was that done?
That was done in 2016.
So prior to that, did you also have sinus cloggage as well?
Yeah, I had sinus cloggage, sometimes bad nosebleeds.
Mm-hmm. So since after the surgery, have you noticed the sinuses got more clogged up or pretty much the same?
A little more clogged up, a lot pressure, and I'm having trouble falling asleep and breathing while I'm sleeping. Okay. I think it may be contributing to my sleep apnea.
Understood. Also, do you know what did they change inside in your septum or your nose?
What did they change?
No, what did they change in there? Do you know what the surgeons did inside there?
I do believe they cleared out cartilage on both sides of my nose.
Gotcha. With a deviated septum, all right, I want to take a look at what's going on right over here. Right? Now, the fact that you had a surgery done, that changes the game a little bit. So this is your septum right over here. And they actually did a pretty good job. It's almost straight. However, you can see over here, it tilts a little bit to the left and tilts a little bit to the right. Just very, very slight, but it's there. But what's more important is the fact that to me, and that's why I asked you about your sinuses, is that, ever since you had the surgery, you notice that sinuses are a little more clogged up. Why? Because what I'm seeing over here, you just don't have conchas, right? So what is a concha? I'll show you over here. So these are conchas over here. They're little bony protuberance sticking out. Why do we have them? All right. So when we take a look at why we call them conchas is because just like a seashell concha, they're spiral shaped.
Yeah.
All right. Now, just a concha is like this. Okay. We're talking like a seashell concha. It's supposed to be a spiral shape. All right. Now, when you take a look at the three-dimensional aspect of it, okay, septum's over here. Okay. Concha's like over here, here, and there. All right. Okay. Now, what is the purpose of these things over here? All right. The purpose of it actually is to create a vortex. All right. Just like a tornado. Okay. We want that the air to start spiraling into our intranasal cavities, and then it goes into our sinus cavities. All right. We have multiple sinus cavities. We have the frontal sinus over here, maxillary, nasal, and also the the sphenoid sinus, all the way deep inside as well. All right. Now, here's the thing: if all the vortexes are working properly, just fine, you should have like a wind tunnel effect. Keep on blowing all the way through, and then no problems. However, because these are reduced or completely eliminated, we don't have that tornado effect as much. Okay. Now we just have some. Now this is where chiropractic come into play as well, because if we have any type of neurological problem going on, all right, it's going to affect what's going on with your skull. So bear in mind, your skull is not just one bone and stays put that way. No, actually, because our brain is floating in cerebrospinal fluid, every time we breathe and also every time we walk, our skull, it expands and contracts. Very subtle, very slight. Okay, we're talking like not even 1 millimeter. It's very, very subtle. Okay. Now, again, because it needs to expand and contract, just like a bridge, what happened? We had those road decks that expand and contract very slightly due to temperature and all other changes going on, so on and so forth, right? Now, the fact that our skulls, okay, we have like a left hemisphere and a right hemisphere, it moves this way, that way, so on and so forth. It's very subtle, but our sinuses are in there as well. So when the sinuses start changing, okay, and we see this little dip, okay, just to make it easier to demonstrate to the viewers, if it really moves up and the wind kind of blow, now we got a little turbulence going on, okay? It's not smooth sailing. It's got to move over that. So when it hits that little ridge, what is going to happen? All that debris that we're breathing in gets stuck in that corner. It's like no different like when we try to clean like the edges of our floors or whatever it is, eventually it gets stuck and trapped in that corner, okay? That's why we're gonna get a brush and we're gonna like brush out that corners out, right? So the same story with the nasal cavities as well. So if we remove those conchas as well, we're losing that vortex effect. So it's gonna have a harder time to reach those little corners and those little edges. So if those buildups, happens over time, what is gonna happen? The sinuses start clogging up. So the maxillary sinuses start filling up, frontal sinuses start filling up all that debris. Now the body, how do we remove it? One component is, okay, physically, we have the air blowing all that garbage out of the way. Another component is mucus, okay? Mucus, just like in our nose, inside our mouth, and our throat, is loaded with high concentration of white blood cells. Those guys are our garbage trucks. They eat up all the bacteria, viruses, mold, fungus, all that stuff, and any other object that doesn't belong there, they'll grab onto it and try to digest and break it and get rid of it. However, if it can't do that, okay, next component is your body starts to release even more mucus. So that's why when it builds up enough, what happens? We blow all that snot out of the way, all that mucus out of the way, right? And what happens at the next level? If it keeps on chronic for many years, keeps on building up over time, next component, our body has no choice, but it starts developing all these polyps. All right? So all these polyps is like, okay, we got to increase the surface area of the sinus cavities to have all these white blood cells to try to destroy even more of that garbage out of the way. So that's why the real answer is no, we gotta actually try to find a way to restore the conscious. However, unfortunately, I'm not a surgeon, I can't do that, okay? The next component I could do is, let's restore the nerve function to the skull itself, all right? And also the soft palate, and also the mucous membranes, because if there is a potential problem, okay, in this area over here, causing a traffic jam, how do we expect your mucus glands like this to function properly? Okay, it's gonna have a hard time doing so. Therefore, it's gonna either build up too much mucus, or it's gonna have a hard time trying to realign the bones in the skull itself. Right? Okay. So that's what the strategy is gonna be. So not only am I gonna take a look, examine what's going on with your deviated septum, okay, your sinuses. I'm also going to take a look what's going on in your spine as well. All right. So this device right here, this is instrumentation. So the purpose of it is when there's an inflammatory process going on due to a damaged tissue structure, it releases more inflammatory products, and it also increases the vascular supply in the area. It does so to introduce more white blood cells in the area to try to check out what's going on in the area and try to repair and heal it. Now, one of the byproducts of that increased vascular supply is going to be more heat. And that's what this device picks up. So it helps me narrow things down and see where all the other potential issues going on in your spine. We got some pools of edema right over here, the swelling. Same story over here, there's pool and edema swelling over here. And this one is very obvious over here as well. There's a lot of pool and swelling over here. And also, right, there's a lot of muscle spasms, tightness over here as well. Now, other thing I'm doing is, I'm also observing his x-rays. And I'm overlaying that x-ray data in my mind along with the spine. And I'm checking for any potential issues. I'm confirming it and overlaying it with him.
The sacroiliac joints are kind of decent, not too bad. But I do see on the x-ray there's a potential issue going on that fifth lumbar, and we're going to confirm it on it. That's not moving at all. Tender right there, sir?
Yeah.
Yeah. That's in trouble, right?
This right here. What about this fellow right here?
Yeah.
Yeah, not too good right there, huh? See, you feel that big knot right there?
Mm-hmm.
Yeah.
Especially right there.
Yeah, this fellow right here is
Yeah.
pretty big. Now we're checking on that spot right there. How's that fellow right there? Not too good, huh?
Oh, that's exactly what the pain is.
Yeah. That's that fifth cervical right there. Okay, so that's what I'm seeing over here. I don't know if you guys can see it over here. There's like a cavity in there. Okay, there is absolutely no conscious in there whatsoever. It's completely, yeah, they trimmed it off. Well, you do have some in here still left over in here. But on your right hand side, it's not too bad on your right, but your left, they trimmed it. Okay. Now we just confirmed it on you, all right? So your fifth lumbar is in trouble. That sixth dorsal, that's something we need to address, right? And including that fifth cervical as well. So these three, we're gonna address these three. In addition to, just like I covered before, that fifth cervical, right? That's the fellow that goes into, that innervates the mucous membranes. I want you to close off your left nose. Okay. Go ahead, breathe in and out, hard as you can. Okay, close off the other one. Okay, that's pretty restricted there. Drop the belly. There you go. Right there. Let it go. Go ahead, breathe, sir. I know it's intense. Just breathe. Okay, do one more. Wow. I like shoulders, huh? There it is. Coming up, sir. All right. Okay, turn around, sir.
Holy.
Okay. What's different, sir?
I'm breathing. I can feel.
Okay, take a nice deep breath in. No. Block off your left nose. Okay, other nose. Okay, tell me, what's different in there?
I feel more air. This one was stuffed up. I feel more air going through there.
Good.
Yeah, I definitely feel more air. Mm-hmm.
See, just to reiterate once again to the viewers, that's why we had to restore the nerve, okay, from your neck into all your sinuses and all mucus and the whole entire structures, everything else like that. That's why it's that important to get that fellow working again, right? So share to the viewers, how much improvement would you say right now from 0 to 100%?
About 90.
90, just from that alone.
Yes.
Okay. Face up.
I didn't feel like this when they took the splints out of my nose for the Deviated Septum. This, like, as soon as you did it, I could feel the air condition going in my nose.
First thing first, see, they really operate on this thing. There's usually some kind of fixation in the septum. Okay, it's nothing. See this? It just wiggles. See, it wiggles again. There is just nothing for me to attach on, so nothing for me to move the septum to. However, his nasal bone itself is stuck. It's not moving right. Right there, that's stuck. See, maxillary sinus is also stuck. So it should be moving. It's not. Frontal sinuses. See, this is moving on the right side. Left side's stuck. Okay, so we're going to be doing a lot of corrections here. Here's a piece. Here's another one. Whatever.
Ah.
Yep, sorry. Had to move it because it's stuck. Same thing with this one. Here's the other one. That's a nice set. Whatever. There it is. The sphenoid slightly out. A little more. Okay, coming up, sir.
What's different, sir?
I don't feel any pressure in here anymore. I can feel air flow through before. When I breathe in, I will feel pressure right up in here. Right in this little area right here. Now I can feel the air flow freely.
Nice. Nice. Okay, how's everything else feeling?
Good. It's opening up. Like my eyes like doesn't feel puffy. I can breathe.
Okay, go ahead. Block off your left nostril. Okay. Block off the right nostril.
They're the same now. Before it was, you could tell the difference. You can hear it in the air that's flowing.
Mm-hmm.
Now they feel both the same. Much more oxygen.
There's another thing, I don't know if your viewers can notice. You could really hear the wheezing prior to the adjustments. Okay. And now, no, you just don't hear anything anymore. So now bear this in mind. Okay. Because we realign your facial bones and got the sinuses to realign it even more. Okay. Don't be surprised you're going to experience some drainage out there. So there's 3 common types of experiences people experience. Okay. Either you're going to feel like one heck of a waterfall going down the back of your throat. B, it's going to feel like a little trickle. Okay. But you feel like you need to cough it out. Okay. And the third one feels like, there's something like moist going down, but it's like, I feel like I want to cough something out, but there's nothing to cough out. Okay, so don't be surprised about that experience for the next 36 to 48 hours. All right, it's common. If you want to speed up that process, I do recommend get like a nice hot bowl, hot towel, and just breathe the vapor, right? The steam vapor, right? Just take a nice deep breath in, and now just let it just flush all that junk out of the way.
Okay.
Right?
Because that's all the debris, like you said before.
You got it.
Was sitting there, and now it has to come out.
Exactly. Bingo.
Okay.
All right. That's what the story is, sir.
Thank you.
Oh, you're very welcome, sir.
Thank you.
All right, have a good one.